Hi, I'm cancer physical therapist, Dr. Leslie Waltke. Welcome to my lecture on pain, weakness, and fatigue in metastatic breast cancer, and their impacts on length and quality of life, and what to do about it. This lecture is going to be geared towards people living with metastatic breast cancer, but will be applicable to healthcare professionals and rehabilitation professionals as well. One of my more common quotes is this: living with metastatic breast cancer is like running a marathon without a finish line. And just like a marathon runner who needs someone to help support them staying pain-free, healthy, and strong, so does someone with metastatic cancer. So I always encourage people living with metastatic disease to have a rehabilitation professional on their team to help them minimize the pain and stay strong and functional, to help them maximize their quality of life and maximize their treatment options. Topics we're going to cover in this lecture will include these. Why do pain and fatigue matter? They have massive impacts on health. Where is the pain coming from and why is that important? How to keep an eye on your physical health so you don't get surprised going up and down the stairs someday about how weak you may have become. And then again, what can you do about that? And then we'll finish up with exercising like your life depends on it, because it does. So why do pain and fatigue matter? Because pain and fatigue can be huge burdens for somebody undergoing treatment for metastatic cancer. They matter for a bunch of reasons, and it's the impact that it can have on your health. It can impact your psychological health, your physical health, and it can even impact your treatment and your treatment options. So let's talk about those things. So let's begin by talking about your psychological health. First of all, let's ditch the notion that just because you have metastatic breast cancer doesn't mean that you can't be healthy, that you do and should expect to be pain-free, or at least minimize the pain or the fatigue that you have. Depression is real, and depression can be exhausting, and depression can lead to more fatigue. So it needs to be addressed. Because if you have depression, it's just going to cause more exhaustion and more fatigue, and you can get stuck in a negative feedback loop. Anxiety is real, and anxiety is exhausting. So fatigue can cause anxiety, anxiety can cause fatigue. So another negative feedback loop we want to get you out of as best we can. Pain and fatigue can also be a reminder that you have cancer, and they can also be very worrisome, like, oh my God, now what's wrong? So that's why it's really, really important to minimize the amount of pain and fatigue somebody copes with so we can take a lot of this stuff off of your plate. And then when it comes to physical health, this isn't surprising, but pain and fatigue both can decrease your ability to do your normal daily routines, getting dressed, showering, going to the grocery store, cooking dinner. And then it can also decrease your activity tolerance. Can you work a full day and still go to the grocery store? Can you go out to dinner with your friends or go to a movie or go for a hike on the weekend? It can also impact your ability to do your job and work full time. And it certainly can decrease your quality of life, which again is not acceptable. When it comes to how pain and fatigue can impact your treatment or treatment options, there's two things that your medical oncologist will look at, among many, is regards to how well you're responding to the treatment or how your body is handling the treatment. And those are ejection fraction and performance status. Let's take a look at those two things. So your ejection fraction is a test that kind of gives us a general idea of the health of your heart and the pumping ability of your heart. So the ejection fraction is actually the amount of blood that's pumped out of your heart's lower chamber when it contracts. So it comes in a fraction, and a fraction of 50% or above is normal. So your physician will watch your ejection fraction, and if it starts to drop below 50, they may have to stop the chemotherapy. Performance status is a scale of 0 to 4 that gives us a general idea of how well somebody's functioning in their daily activities. So a 0, this is one of the few times in life you want to be a 0, is somebody who's completely normal and can carry on any ADLs. They can go to work, they can do whatever they want without restriction. As you go up higher in the scale, a 1, 2, 3, or 4, people become more restricted, where a 4 then is somebody who is completely disabled and cannot carry on any self-cares or are confined to bed. So the stronger and healthier and more and better performance status you have, again, you're going to be able to tolerate more chemotherapy, and you're going to have more chemotherapy or more radiation or more treatment options. So performance status is also important. Now, the key point here is both your ejection fraction, your pumping of your heart, and your performance status are modifiable. So if they start to get kind of crummy, there are things that you can do to make them better. And we'll talk about those things. So now let's talk more about pain. Where is the pain coming from? Because many people with metastatic breast cancer have pain, but let's find out where it's coming from so we know how we can treat it or make it better or what we can do about it. So sometimes the cancer itself can cause pain if it's pressing on a nerve, or it's bothering one of the vertebrae in your back, or it's in your femur of your leg. Okay? It can be some of the medications. Sometimes aromatase inhibitors can cause joint and muscle aches. Sometimes the chemotherapies themselves can cause pain. Sometimes people have leftover pain from a surgery that they may have had months or years ago. Or even maybe a previous radiation site may still be causing pain. So figure out where the pain's coming from, because then that helps us figure out what can we do about it. Is this pain fixable? Can we radiate that bone to make the pain go away? Can we medicate it to make it better? Can we not make it necessarily better, but can a medication mask the pain so even though it's still there, you can't feel it? Or can we fix it? If you have post-surgical pain or post-radiation pain, can you get into a rehabilitation therapist and have them stretch you or strengthen you to make that body part not hurt as much anymore? And then another really important thing to figure out is if you have that pain and you maybe can't make it go away, will activity make it worse? Or will activity make it better? Because even if you have a pain, worst case scenario, that you can't make go away, or is going to be with you for a long time, can you still be active? Even though you have pain, I'd rather you be healthy and strong and active than be in pain and be stuck on the couch. So these are all good things to talk to about with your physician, nurse, and rehab therapist. Common problems in people with metastatic breast cancer include these. Neuropathies are really common. Almost 50% of people that have chemotherapy end up with some amount of neuropathy in their hands or feet. And that's typically results from some of the chemotherapy drugs. Arthralgias and myalgias, those are the fancy words for muscle pain and joint pain. And those are common in people who take the aromatase inhibitors, which is a hormone blocking treatment for people with hormone positive breast cancer. We'll discuss these more in length later in the lecture. Now, here's some things that research have told us, and one of them is that pain and fatigue are often underaddressed by healthcare providers. Yes, we know you're in pain, but sometimes we just kind of forget to ask, or there's so many other important things on your list of things to talk about that asking about pain or asking about your fatigue or your function just doesn't come up. That does not mean that it's not important and it shouldn't be addressed. Pain and fatigue are often underreported by patients, and that too is not okay. I encourage you to complain. I encourage you to report your symptoms to your physicians. And if they're not listening, call a different physician. Be persistent with your needs. And again, we can't fix and help you with things that we don't know about. So I encourage you to let your teams know what's happening in your life and in your body, in addition to just your response to the treatment. So please talk with your cancer nurse or doctor and talk with your rehabilitation therapist about what you're feeling so we can help as best we can. So here are some tips on keeping an eye on your physical health, because all of a sudden it's like, wow, I didn't realize how weak I was, and we don't want that to happen to you. So here are some great tests I recommend that you can do at home on your own to kind of get a good idea of how well your body is handling all this trauma and stress, whether it's from the cancer and or the treatment itself. So try these when you get a chance, but obviously do them in a safe place where you are safe, okay, or you have somebody around if you need help. So the first one is, are you able to stand on one leg? Then try the other leg. And then if you can do that, can you stand on one leg with your eyes closed? That will most likely be a little enlightening. And it's important because, think about it, when you are walking, at some point in your gait phase, you are standing on only one leg. And if all of a sudden you can't stand on one leg very well, it's going to impact your ability to walk, your ability to stand and do things, your ability to get dressed, and all sorts of things. So being able to stand on one leg and maintain the quality of your balance is really, really important. Number 2, can you get down on the floor and get back up again, either with using a little bit of help from your legs or your hands, or using a little bit of help from your furniture? Getting down on the floor and getting back up again it's a good combination of flexibility, strength, coordination, and power. So it's really a good test of how functional overall you are. So if you get down and you're like, holy crap, I can't get back up again, that's a really good reason to ring up your rehab therapist and say, hey doc, or call your doctor and say, I need to start strengthening my legs or my arms, or try to figure out what is limiting you. Is it your balance? Is it your strength? Is it you're just too weak in your heart and your lungs? But that's a really good indicator of your overall function. And simply, can you go up and down the stairs? Keep an eye on that. How far can you walk? I would keep testing that and maybe keep a journal. Like, yeah, I can easily walk a mile, or I can easily walk a half mile or a block. And once you start to notice that's really being impacted long term, okay, that you need to maybe start doing something about that. And again, how long can you stand? Can you stand for 5 minutes? Can you stand for half an hour? Can you stand for 4 hours? And then again, how would you rate your performance status on that scale that I gave you a couple slides earlier? Are you a 1, a 2, or a 3? And if you're starting to get into a 4, is there something, again, that you can do to keep that number from slowly creeping up on that scale? Now, here's what we can do about it if you start to have issues. Number 1, talk with your cancer doctor or nurse about getting you to a rehab therapist. Okay. And again, depending on where your metastatic disease, it may impact your function or it may not. And even if you have bone metastasis, which most people with metastatic cancer do, it doesn't mean that you can't find a way to somehow exercise in another way. So, for example, if you have a bone metastasis in your femur, I'm certainly not going to have you running on a treadmill or running outside, but you may be able to walk in the water. You may be able to swim. You may be able to sit on a stationary bicycle. If you have a bone metastasis in your sternum, you may not be lifting with heavy weights with your arms, but you certainly can walk. So even though you have bone mets somewhere, they may still be safe to do exercises in different ways, or you can still exercise that area, but just in a modified way. So again, if you have pain, will medications assist you in feeling better or being able to be more active with the same amount of pain? It may be a pain medication, it may be an anti-inflammatory, it may be a drug that kind of calms your nerve endings. Rehabilitation therapy, seeing a physical therapist or an occupational therapist may be very helpful. Stretching exercise, strengthening exercise, aerobic exercise, and again, balance and functional exercise. Making sure you can stand on one leg, making sure you can still go up and down the stairs and stand for 10 minutes, 30 minutes. Those are all really important things to keep working on. So if you have pain from radiation and surgery still, all right, again, rehabilitation therapy is really, really important. Again, whether it was still left over from your chest wall, or maybe you had radiation to your spine or to your leg. Stretching and strengthening is really, really important. And even in the face of advanced metastatic disease, these are things that will still get better. And the better they get, the less pain you're going to have, the stronger you're going to feel, the better you're going to feel. Now, again, another thing I love to say is the only evidence-based treatment for fatigue is exercise. And that is true whether the fatigue is coming from the cancer itself, or most likely it's coming from the treatment itself. So when it comes to cancer-related fatigue, you should be hitting 150 minutes per week of aerobic exercise and strength exercise. They both count towards that 150 minutes. And again, I encourage you to talk with your physician or nurse about getting you to a rehab therapist that can help you build a program, again, based on where your metastatic disease is and how maybe you're younger, maybe you're older, maybe you're fit, maybe you're unfit. Maybe you have lots of experience in exercising and maybe you've never exercised before in your life. So find somebody to help you create an exercise and strength prescription to help you combat some of the fatigue that you're dealing with. Now, when it comes to neuropathies in your hands and feet from the chemotherapy, Exercise will have minimal to no impact on the amount of sensation or pain you're having in your hands and feet. However, you can try masking medications. Gabapentin is a common one. That may not fix the problem, but you may not be able to feel the pain as much. That's fine if it works. And again, exercise may not impact the amount of symptoms that you have, okay? But neuropathies are sensory, okay? But if you stop moving because things hurt, you're going to develop muscle weakness. You're going to develop balance problems. You may develop walking issues, and your overall function might go down just because you're doing less, and that's not okay. So exercise will not have an impact on the amount you feel, but it will certainly have a huge impact on how your overall function is. It'll impact your ejection fraction, and it will impact your performance status and your overall safety and function. And exercise is not going to worsen the neuropathy. So if you have really sore feet and you go for a walk and they get a little irritated, you're not breaking anything, but you just need to find ways to exercise that don't irritate your neuropathy. So I have a common saying that if you have to have neuropathy, I'd rather, instead of you having numbness and tingling and being weak, I'd rather that you have numbness and tingling and be strong and active. Now, when it comes to the arthralgias and myalgias, the muscle and joint pain from the aromatase inhibitors, please know we don't truly understand what's causing these arthralgias and myalgias, but there is somehow the lack of estrogen in the body is affecting normal pain receptor function. So there is no actual joint or muscle damage happening. So that's nice to know. And if you come off those medications, the pain goes completely away. So exercise has been shown to positively impact and reduce the amount of myalgias and arthralgias that you feel. So the more people move, typically the less pain that they have. And again, exercise is not going to make the problem worse. You can also, in these cases, try masking medications if that gives you some pain relief. And again, as I mentioned, the pain will go away when the medication is stopped. So, exercising like your life depends on it. So here's important things, because if you're on chemotherapy, you may have low blood counts. And no matter how low your blood counts go, your white count, your red count, or your platelets, exercise has been shown to be safe. Now, that being said, if you have a low white count, it's okay to exercise to a level that feels comfortable to you, but we certainly don't want you doing it in a place where you could catch a bug from somebody else and therefore get sick because you don't have the immune system to fight it off. So exercise is okay. We just need to find a way for you to do it. You're not going to go to a mall. You're not going to go to a gym. If you're in the hospital, you can stay in your room, or you can put a mask and glove and gown on and go out into the rehab gym, but you can still exercise. You just need to be protected from getting an infection. If you have a low platelet count, that's the blood cell that helps you clot your blood, you can still exercise. We just don't want you doing heavy exercise that could tear muscles or tear tendons or could cause you to fall and hit your head, and that wouldn't be a good scenario. So again, with low platelets, it is okay to exercise. You just need to modify what you do to decrease the risk of bleeding or falling, but still taking a walk would be absolutely fine. Even if you have severe fatigue, it's okay to exercise or take a walk. You just need to do something that feels moderate at that time on that particular day. So if you are really having a massive, severe fatigue day, maybe try 3 minutes twice a day. Nice, easy walking will typically feel better even for people with severe fatigue. For people who are literally in the last weeks or months of their life, exercise, again, research has shown that it is still safe. But again, we want to make sure people are protected from infection, protected from falling. But if we can use exercise to decrease pain, decrease fatigue, make people feel stronger, stay in their home longer, be more active, get in and out of the car easier, that's a good thing. And as I mentioned earlier, even with severe fatigue, exercise is okay and will probably be beneficial. So exercise for somebody with severe fatigue literally may be sitting at the side of the bed for 30 seconds every 30 minutes, or standing for 30 seconds every 30 minutes, or walking 3 minutes 2 or 3 times a day. Anything you can do is always better than nothing and should make you feel better. So we've talked about that 150 to 300 minute per week exercise prescription to minimize functional loss and minimize fatigue and weakness during treatment. So that again is going to be a combination of aerobic exercise, which is something that just keeps your heart rate up, like walking, dancing, bicycling, swimming. Any of that stuff is okay. Again, check with your doctor and rehab therapist to find something that's best for you and your particular disease type and the treatment that you're on. You also want to do some strength exercise for both your arms and your legs. So we want you doing aerobic exercise 5 to 6 days a week. And again, that can be 3 minutes, 3 times a day, or that can be a 30-minute period. Or if you feel fine, you can go walk for an hour. That's not a problem. And again, we want you to do strength exercises at least 3 to 4 days a week. So just walking isn't enough. We need you to concentrate on keeping the big muscle groups in your legs strong, your hamstrings, your quads, your glutes, like sitting or standing from a chair repeatedly, going up and down the stairs, or doing push-ups against the wall or lifting weights for your arms. That's all really good stuff. So again, when it comes to aerobic exercise, we want you to hit that 150 minute per week, but it is okay to break up your bouts of exercise, maybe a morning routine and an afternoon routine, or even an evening routine for smaller bouts of time if you can't do 20 or 30 minutes in a row. That's absolutely okay. And again, anything is better than nothing. It will make you feel better, and it will keep you from either further declining or actually make you a little bit stronger. And again, when it comes to strength exercise, follow my 10 to 30 rule with the amount of weight that you lift. And that is, if you pick something up, I want you to be able to do at least 10 in a row. Okay? If you can't do 10 in a row, that means what you're holding or what you're pushing is just too heavy. On the other end of the scale, if you're ripping off 30 repetitions and really not feeling much in your muscles, it's probably not heavy enough. So stick with the 10 to 30 rule when it comes to lifting or lifting weights. Do exercises for both your arms and your legs, regardless of what type of cancer you have or regardless where the cancer is. Both your arms and your legs are important to keep strong. And again, the same bullet point, anything is always better than nothing. And people say, I can't exercise, I'm too fatigued. Your exercise needs to be moderate for you on that particular day. And you are probably very well versed on some days you feel really good, or at least a lot less crappy, and some days you just feel horrible. So yes, you can skip a day here or there, but in general, you should be moving 5 days a week. So if you have to move on a day where you are really weak, really sick, really nauseated, your moderate on that day may just be walking out to the street or walking around the block or walking for 5 minutes in the house. And doing 5 push-ups against the wall or sit to stand from a chair 5 times. That may be moderate exercise for you. Where next week, moderate exercise may be walking your 1 mile again. So moderate will change depending on how you feel. But even on crappy days, we still want you to be getting in something so you don't continually get stuck in that negative feedback loop of pain, weakness, and fatigue, which leads to more pain, weakness, and fatigue. And again, specific exercises, anything that gets your heart rate up is absolutely fine. Walking, running, bicycling, dancing, swimming. Again, that will depend on what's available to you. It depends on what you like. It will depend on what you're used to, and it will certainly depend on what is safe for you. So again, talk with your physician and rehab therapist to help you develop something that's good for you. Wall push-ups, just standing up against a wall and doing 10 push-ups is really easy. Even people with significant metastatic disease or people that are super old can do that, or super weak. And even rising and sitting from a chair is literally doing squats, standing on one leg with your eyes open and closed. And even going up and down stairs can be a great tool for exercise right in the comfort of your own home. So research is very clear that exercise in people with metastatic disease has been shown to increase the quality of life and improve the length of survival. So it's certainly going to make you happier if people feel less pain and less fatigue and are stronger. Days are just going to be better. And we don't know exactly how exercise impacts length of life from a physiological standpoint, but it certainly does, whether that just because people's heart and lungs are stronger, but it could be, again, because if your ejection fraction is higher, if your performance status is better, those people are going to have more options to stay on treatments longer or may have more treatment options, and that may lead to longer survival. So both of those things are really important and really good. So again, exercise like your life depends on it, because it does. And again, treat yourself like you are the most important person on the planet, because you are. And again, please don't think or just assume because you have metastatic disease that you are supposed to be miserable. Yes, there's going to be times when you're miserable, but that should not be all the time. I actually help run a triathlon training program for female cancer survivors, and every year some of those survivors that come screaming across the finish line after swimming, biking, and running have metastatic breast cancer. So you don't assume that you're supposed to be miserable or can't be healthier than maybe you are. And again, exercise like your life depends on it, because it does. Before I go, I want to share a free resource with you. It's called The Recovery Room, and it is a Facebook page that I have. It's also found on YouTube. And we have tons of educational videos specifically for people with cancer. And we have videos that are short, they're positive, they're easy to understand, and they're medically accurate. And they deal with a lot of topics just like this. I run it, so I'm a physical therapist, so we talk about health, exercise, pain, fatigue, recovering from cancer treatment, going through cancer treatment. So we have a full library of things that you can look at. So please do feel free to check out the Recovery Room and subscribe there and let your fellow cancer survivors and support groups know about it as well. And in the bottom left-hand corner, you will see the name of my academy, the Waltke Cancer Rehabilitation Academy, and my website is waltkeacademy.com, and there you can find my contact information if you have any further questions. Thank you for the opportunity to talk with you. Take care of yourself. Exercise like your life depends on it, because it does.